You're watching ABC4 News.
Welcome back, everybody. We're talking more about the COVID-19 vaccine and how healthcare workers across our state are making sure we all know about it and its importance to overcome this pandemic. Amanda Hartman, the administrator of the Uinta Basin Rehab and Senior Villa, joining us via Zoom today to talk all about this. So, Amanda, let's start off with what kind of education are you providing to your community?
Yes, so with our employees, we've been having several employee sessions, virtual, of course, due to COVID, but just trying to help debunk a lot of the myths that are out there and getting the information from the CDC into our employees' hands.
Information,
also trying to educate.
Yeah, information seems to be kind of the problem. So let's talk about the barriers or challenges that you're facing when you're trying to make sure everybody's on the same page of what really is going on.
Yes, absolutely. I think the greatest barrier is the fear of the unknown. Because there are so many different outlets out there for information, be they true or not so much. It's really been hard. It's kind of been a difficult thing to focus everyone's efforts in on reputable information and trying to, waylay some of the fears that staff, residents, and families have.
Because fear is real, and unfortunately the information always isn't on point. So let's talk about the vaccine. Why is it important to get it and for your facility, and how will it affect you and all of the people that you work with?
Yes, it's really pivotal for our particular facility. So anyone that knows much about the long-term care industry knows that there's what we call an Eden philosophy, which says that the 3 plagues of loneliness, helplessness, and boredom are something that our elderly deal with a lot. And this pandemic has exacerbated those immensely. So this vaccine to us is the gateway. It's not the cure-all, it's not the solve-all, but it is the beginning for us to be able to open our doors again to families. It's the beginning of our residents being able to come out of their rooms and resume life as they knew it. And in order for us to do that, we really need at least 80% uptake of this vaccine within our residents and our staff to make that possible.
Have you received any vaccines yet? Do you believe that'll be happening in the following weeks?
We are sure hoping. Our local hospitals got it today. We have not. Our pharmacy partner has not sent our vaccine, so that is obviously step 1 for us, is getting the vaccine here and then getting at least 80% uptake so that we can move forward and move out of this thing, as safely as possible.
Oh, I'm sure that you are just so anxious for that to happen. Let's talk about when you believe the vaccine will be ready for the public. Obviously, there's kind of a pecking order on who needs it first and who doesn't. So when do you think that the overall public, who might not be as high of risk, might have their own access to it as well?
To be honest, I don't know. I've heard varying reports. I know we're doing kind of first wave healthcare workers now. Long-term cares are mixed within that. I'm hearing reports of, early spring, but I don't know, to be honest with you, when the Utah Health Department will push that out.
And I think my final question to you, Amanda, is just talking to people out in the community. You've got quite a few people watching you right now. What would be your suggestion when it is an opportunity to get the vaccine? Kind of your suggestion to make sure someone does go through with it.
Yeah, absolutely. I would just encourage anyone, educate yourself, educate, and do so from reputable sources. The CDC, the Centers for Disease Control, is, the core course of that information for you. Go there. Stay away from social media reports, stay away from those kind of things. Educate yourself and do what you can to protect yourself and those you love.
Okay, Amanda, thank you so much for joining us via Zoom today. We do appreciate it. Thank you for all that you do for that community there, those residents. We look forward to them being able to see people very, very soon. So thank you so much for joining us today. We do appreciate it. Coming up, we're going to take a look at the